So, good afternoon, guys. Today I'm here with my good friend Mr. Dave Johnson. Today we will be talking about Sri Lanka's healthcare system, primarily what it lacks. We all know, for example, that Sri Lanka, out of all the countries in South Asia, has one of the best healthcare systems in the region. A lot of people, a lot of organizations have accredited us for that. And when you would compare us to countries such as Cuba, even Cuba, despite it having not such a great name in terms of economic development, when we relate it to the healthcare sector, Cuba is right up there. It's performing on many levels very well. And that is why I thought today we discuss a topic that affects us all, and that is healthcare. So, Dave, welcome. Pleasure to have you. And I would just like to ask you if you could introduce yourself to the audience, a little bit about who you are, and then we'll take it from there.
Thank you, Sean, and thanks for having me. It's kind of a nice day here in Washington, D.C. It's kind of a rarity in the summer. I was an officer in the Navy for between active duty and reserves for 20 years. I was intelligence. This is many years ago, before I got involved in medical work. And currently, I've been working with medical technologies. Been doing that for over a decade, specifically related to cancer detection, cancer mitigation strategies. And as an overarching background, just looking at systems in general and saying, where are there deficiencies? Where is there something that we can fix, maybe improve a little bit? And taking a look over the past, for some time, looking at the Sri Lankan healthcare system, I'm impressed by, there are a lot of successes. It's a good system, and everyone has access to it. It's a universal system that people have. That's a strength. There are disparities. There are areas that could be improved to make it even better. And that's kind of my focus on analyzing this and researching it, has been to look for some of these areas and develop some strategies for addressing them.
I think that is exactly why we are discussing this topic, because it is about addressing these disparities that do exist. I think that's why I started off by saying that we have a great system in place, but a system that can be further improved. That's why I would like to start off by asking you the very first question: what are the biggest improvements that should be or can be made to the Sri Lanka's healthcare system, considering the current predicament that it is in?
I think that, as we touched on, it's a system to be proud of. Citizens should be proud of it in general. The government, the officials, everyone involved in it. It's not something that's just broken. It's something that can be fixed to make it stronger and
with
make
the right
it more
tools.
enduring with the right tools. And I would say the biggest issue from researching it and analyzing it, talking to people, is the disparity that exists between urban areas like Colombo and rural areas in the country.
Yes.
There's a massive difference between access to care, technologies available, capabilities, modalities, everything that you can imagine, massive difference. And looking at this at a deep level, I believe we can take some technologies, telemedicine, telehealth, remote patient monitoring
and
type
apply
capabilities, and apply them directly to those areas that are more deficient without coming in and saying, hey, the whole system needs to be overhauled, because that's not what it is. It's not that at all. There's a lot of great capacity inside the system. It's maybe rearranging some pieces a little bit or adding some companion technologies. And it goes from being, a B plus to being an A with some work.
I think we have some of the best doctors in the world.
Yes.
Unfortunately, a lot of these doctors, and many of you know, have migrated to other parts of the world because of the economic crisis that Sri Lanka has faced or is still facing. And it's quite unfortunate. But Dave, carrying on from what you just said, what would you think is a short-term initiative that can be implemented today, that's something that can immediately improve a certain sector of healthcare or healthcare in general?
I would say, given the shortage of medical professionals, as you alluded to, and given the gaps that we're aware of in, again, more rural areas, if we were able to incorporate a very enhanced telemedicine capability right off the bat, that would leverage a limited number of doctors and make short appointments, trying to get a handle on things and documenting things with technology. So taking advantage of the fact that technology exists and can exist somewhat inexpensively, that would be the number one thing to jump in on.
And I would also like to just add to something like that, because me being half Sri Lankan, me having lived in Sri Lanka, me having read all these reports, it's quite unfortunate that even the previous government had actually created a plan where they create this corridor in the western province of Sri Lanka for all the medical treatments. I'm not a medical expert, but I've heard stories of people having to travel 8 hours in a bus just to get to that correct hospital that they need to. I mean, I'm not saying it's an issue. I mean, we are not the biggest country in the world, but these things can be improved,
Yes.
and technology could play a real factor for the people far away.
And absolutely, and Sean, I believe that when someone has a condition of some sort, even if it's somewhat minor, them traveling a long distance to go to a medical facility is not a good idea. Just
not a good
on
idea.
every level, psychologically, physically, emotionally. So having someone you can reach out to, having a professional person you can talk to, either on the phone or on the computer or on your cell phone, whatever, using all these current things we became used to during the pandemic, technologies and capabilities, that does a lot. And saying, hey, look, this sounds like this is something that needs to be looked at this way. Maybe you run some tests that could be done at a local hospital that doesn't have all the state-of-the-art, like you're talking about the corridor. That sounds like state-of-the-art equipment, newest stuff, best stuff. Maybe those things aren't necessary, depending on the person's condition. But having a friendly face on the other side of the line there, so to speak, that goes a long way. And again, that's where I think that's where the gap, the immediate thing we could work on, falls down into that area. But I do think the capabilities and technologies are very concentrated in Colombo. And
To a certain,
yeah.
a segment of Sri Lanka.
So going further in your question, there are very specific diagnostic tools that are not that expensive that could be distributed out to some of these areas that a community of people could have access to for testing. So rather than putting a large portion of your technology in one place, you spread it out a little bit. But if someone needs absolutely needs a capability that only exists in one part of the country, then that's the unfortunate part. But I think we can make major gains in those areas by looking at the problem and doing really what I call a gap analysis and saying, okay, let's break the country into micro segments, and let's look at 1,000 people segments. And you take the population and you say 20,000 times 1,000. You get into these micro, and so what's the whole here? Well, this gap over here is access to medications or whatever. So as you get deeper and deeper into it, you're tearing apart the problem instead of just kind of broadly applying something at the top level, saying, well, the country needs better this. That doesn't really help anybody. It's kind of like weather. It's like, in my little town, it's pouring down rain, and 500 miles to the west of me, it's dry as a desert. Don't say that we're kind of like mixed between rain and it's got to be specific. And I think the more specific the healthcare analysis is of the gaps, the better that will serve the people.
It's interesting actually that you brought up this argument of dividing into segments. So let's segment it now. Let's talk about the elderly population. How would we treat that segment better? How could we make life better for them?
I think that along the lines of the telemedicine, telehealth, community-based care, where you've got a community, you have a couple of professionals, maybe you have some people that are helping some of the physicians actually go and meet with a person who's elderly, perhaps who lives alone. That's very important psychologically. And a lot of people get isolated. And this happened to everybody during the pandemic, but ultimately it happens more prevalently with the older segment. So a combination of some regular in-person visit, and the reason for that is not just from a psychological boost point of view, but also someone can come in and find out a lot about a person just from meeting with them for a few minutes.
Yes.
And they can see, hey, this person met with them 6 months ago, and I'm seeing a decline.
Yeah.
Or their home seems to have maybe some issues that might be indicative of mental decline. or the cleanliness standard of their home has gone completely down. They might not have as much mobility. Things that they wouldn't necessarily tell you about on a telehealth type thing, but a person witnesses it and says, hey, look, I think there's some things that need to be looked at here. So I believe that's the number one thing that could be used. And then again, companion for rural areas, seniors in rural areas, telehealth, having someone they can have access to talk about issues and so on. I believe those are all, again, go a long way. Yeah. But people shouldn't have to be isolated.
Of course.
And being able to just say, hey, look, it's okay to have someone come visit you, or you can call me, or we can get on, Zoom, or whatever the appropriate app is. And that maybe a phone gets provided to them. Maybe the family makes sure that person has a cell phone or knows how to use it, or someone younger in the family can teach them how to use it.
It's interesting that you mention such things, because when I look at Sri Lanka and I have visited elderly homes, one common way that Sri Lankans try to promote development is just by building a hospital. It's just by building an elderly home, providing the basics for that and expecting that to result in solving all the problems. When I visited an elderly home once in the vicinity of my house, I just saw people neglected. Of course, you're safeguarding them and you're looking after their basic needs, but you're not solving the problem entirely. Right. One of the biggest issues in Sri Lanka that I also see that drains the healthcare sector is the fact that we always have to import medicine. Yeah. We are not a country that is self-sufficient in producing our own medicine. As a result, that results in a lot of our foreign exchange also being drained through the procurement of medicines that primarily originate from India or Switzerland or wherever it may be, wherever these pharmaceutical hubs are. I just wanted to bring that in because it just shows how many number of different areas that Sri Lanka has to improve on. And we spoke about the elderly. We can now speak about the children. I mean, we all know that children are malnourished at the moment in Sri Lanka. Yes. I don't think that's to do with healthcare. That's mainly to do with the fact that disposable income is low. A lot of the children in Sri Lanka are not getting the right potassium, all these little nutrients that they need because of the fact that they're not able to afford a balanced diet. So now that we spoke about the elderly, kids are the future of Sri Lanka. They are the ones who deserve the best in life. I mean, they're young, they're innocent, and they have a future ahead of them. When we talk about children, what would you say that we could talk about that segment?
When you talk about children, there are global problems with children, I mean, that occur in a lot of countries. You touched on the nutrition. The number one issue, in my opinion, having researched the topic pretty deeply, is nutrition. I think that's a huge problem. And it's related between socioeconomic conditions, medical facilities, but I would also say a companion, maybe a close second, if you will, is mental health. And given the conditions and given things that have happened in the country and some of the history and a lot of things, mental health can't be ignored. Yes. And it can't be pushed off to the side. So as you talked about building a new hospital facility, that's great. Everyone's in a nice, shiny, brand new building that smells new and fresh. Communicating with people, having professional people talk to children, talk to seniors, actually communicate with them, human to human.
One of the biggest issues in the world today is mental health. I mean, I'm telling you something, there is a lot of kids, a lot of adolescents who in Sri Lanka suffer from issues that they are unable to discuss, even if it was with their parents, basically because they think it's irrelevant, but no, it finally affects their life. It affects the way that they can contribute to society. Yes. And mental health is prevalent today almost in every country in the world to a large degree.
And there are things that can be done, and again, a gap analysis. So if you were to say that, a large significant number of children in the country have some childhood trauma, and it can be related to lack of access to food. It can be related to lack of access to proper housing, family dynamics, lots of reasons that create some sort of trauma for a child. And that trauma manifests into potentially a long-term mental health problem. And trying to understand the cause and effect relationships and establishing systems where people actually look after each other in a community. And that's why I say community-based care. Sri Lanka's population is relatively small on the grand scope of things, but it is large enough to leverage to create some of these capabilities. If every 10 children had one person they could talk to, just about anything, you create structures. You're not taking away from the family unity and cohesion, but sometimes children, I know this for a fact in a lot of countries, especially the United States, children won't talk to their parents about things. Yeah. They'll talk to a teacher or they'll talk to someone they perceive. It can be a supplement if the person they're speaking with actually has interaction with the parents. So it becomes an additional ear, a set of ears for the child. So, but I believe nutrition and mental health for children. I think mental health also for seniors. There's sort of consistent themes across the entire population.
But the lack of nutrition finally does affect the mental health, which is another problem.
It all connects.
And that is why we are so grateful for the World Bank, for all these institutions here in America to have supported us on our journey, and we are very grateful. But now let's not paint this ominous picture. Let's talk about what Sri Lanka has done right, because Sri Lanka's healthcare system, as I mentioned in my monologue, is respected. It is respected. It has done well for its people. You told me earlier today, it still deals with the needs of the grassroots level people. There are more opportunities when you look at medical health tourism. That means, on one hand, we are bringing in tourists, to have fun in Sri Lanka and look at all the sites. But then there's a total other market for tourists who want to come on a wellness journey. Tourists who want to come and solve a health issue, who can afford it because of Sri Lanka's affordability. And that's why I thought I would end this discussion by talking a little bit about what Sri Lanka has done well, because we have to give credit where credit is due.
Absolutely. And I would say that, as I alluded to it earlier, but it's a system for people to be proud of. Yes. It is a good system. Everyone is part of it. It's not, 5% of the population has access to the system and the rest are out to dry, hung out to dry. It's not like that. Everyone has access to it. It's just what within the system do they have access to? And that's where the disparities come in. But it is solid. And I think given some of the previous initiatives, different programs that have maybe not come all the way to completion, there's a lot of thought that has gone into how to improve this and make it better. This is not a new concept, improving it. It's just looking at it from a slightly different angle and leveraging capabilities that exist in the United States, relationships that exist in Sri Lanka with folks from the United States, kind of connecting those two and bringing capabilities to bear. And again, bringing Americans going to Sri Lanka for care on a medical tourism type scenario, that's a very positive thing because the system is quality in the country. You have quality professionals, you have quality technology.
We have the infrastructure, we have the human capital. It's about connecting the dots.
It's connecting the dots and building that out. And again, I think
in a sustainable manner.
In a sustainable manner, and listening to people that are on the ground, professionals that are like, look, this is, some of the big reports might say this and this, but what the real issue is this other piece. We really need a little bit more detail here, or could somebody emphasize this? That's the insight which can help you build the system at a grassroots level, not build it, but improve it. Instead of coming in and saying it all has to be burned to the ground and we have to build something fresh and new, that's not the case at all, and that wouldn't work. Got to use what exists and what is already doing well and successful capabilities, and expand it and connect them. And I think the system it improves considerably. The average citizen's like, hey, things have improved, and I feel good about my family is in better shape. I'm able to care for my elderly parents. My children are doing better. There's a lot of, maybe one child had a mental health issue of some sort. We're working through that. We've got people that child can talk to. We have people we can talk to. That's where I would like to see this go, where everybody's like, hey, things are better, and we feel good about it. And I think that momentum is what we want to capture. Not just, it's as good as it can be, and I guess that's not good enough. That's not the answer. It has to be improved over time. But I think the more something improves, the more people want to make it even better and better.
So Dave, thank you so much. Pleasure having you.
Thank you, Sean.